I'm pleased to welcome two presenters from the Administration on Community Living this morning within the U.S. Department of Health and Human Services, Allyson Barkov and Anjali Forber-Pratt. You guys could please join me at the stage, and I'm going to read your bios to everybody. The title of this plenary is Federal Initiatives. Our speakers will be giving prepared presentations and will be responding to a series of questions prepared by the organizers of the conference. So let me introduce you to first, Allyson Barkov was sworn in as Principal Deputy Administrator for the Administration on Community Living in January 2021 and is currently serving as ACL's Acting Administrator and as the Acting Assistant Secretary of Aging. She provides executive leadership and coordination for ACL's programs nationwide and advises the HHS Secretary on issues affecting people with disabilities and older adults. In her career, she has served in a variety of leadership roles, including leading advocacy efforts at the Center for Public Representation and the Bazelon Center for Mental Health Law, serving as special counsel for Olmstead Enforcement in the Civil Rights Division of the U.S. Department of Justice, leading interagency initiatives with the Centers for Medicare and Medicaid Services on Medicaid, Hcbs, and the Department of Labor on direct care workforce issues. As part of countless coalitions of people with disabilities, older adults, and advocates, she has fought to uphold the rights of people with disabilities and older adults and advance policies to ensure their access to health care, housing, employment, education, and all other facets of community life. Allyson has brought the same focus on collaboration and coordination to her current role. Under her leadership, ACL is working with partners across HHS and the federal government on initiatives and interagency approaches to issues that affect people with disabilities and older adults, such as expanding access to Hcbs and affordable, accessible housing, strengthening the direct support workforce, increasing competitive integrated employment opportunities for people with disabilities, and advancing equity, to name just a few. On a personal note, Allyson is a sibling of an adult brother with developmental disabilities and a civil rights attorney, and I will add that Allyson gets it. Anjali Forber-Pratt is the director of the National Institute on Disability, Independent Living, and Rehabilitation Research, also known as NIDLR, at the Administration for Community Living. In this role, she was responsible for generating new knowledge and promoting the best practice to improve the lives of people with disabilities while pushing the maximum inclusion and integration in all aspects of society. Her most recent previous position was the assistant professor in the Department of Human and Organizational Development at Vanderbilt University, where her research focused on the training of special education teachers, experiences of students with disabilities at every educational level, and identity development. She has authored 33 peer-reviewed journal articles and is the author or co-author of a number of textbook chapters. In 2020, she was awarded the American Psychological Association's inaugural Citizen Psychologist Award for advancing disability as a human rights and social justice issue. In 2013, she was awarded the Paul G. Hearn Leadership Award by the American Association of People with Disabilities, and in that same year, she was also named a Champion of Change by the White House under President Obama. On a personal note, Anjali is a bronze, silver, and gold medalist in wheelchair racing and skiing events at the Paralympic Games and World Championships and is a former world record holder in the 200-meter race. So please welcome I'm going to turn it over and let our panelists do it from wherever you're most comfortable.
Good morning, and thank you, Amy, so much for that introduction. And really thank you to everyone at the Reinventing conference for including ACL and giving us the opportunity to share with you some of the work that we've been doing together. And of course, thank you to all of the hosts of Reinventing Quality, some of the leading organizations that have been partners with ACL and with the broader disability community in advancing the rights of people with intellectual and developmental disabilities. As Amy mentioned, my name is Allyson Barkov, and I am the acting administrator and assistant secretary at the Administration for Community Living. And it is an incredible privilege to lead an agency that is so mission-driven and really aligned with the work that we are talking about today, that this entire conference is about. Our agency is focused on ensuring that all people have opportunities to fully participate and be included in their communities in all aspects of life, regardless of age, regardless of type of disability, and regardless of level of support. And as someone who has been in and out of the government and worked with so many incredible nonprofit organizations, I want to say that ACL is one of the most mission-driven organizations where I have been. We play a really important role, and for people who aren't familiar with ACL, I just want to talk a little bit about the range of things that we do. First of all, I want to say, in addition to Anjali, we have other staff here, and I would really encourage you to talk with them over the remainder of the conference. In the green shirt at the front table is our Commissioner on Disabilities, Jill Jacobs, who brings an incredible amount of personal experience and expertise, both boots on the ground. And Jill always says to me, literally every day, how are we going to take what we're talking about and turn it into reality in people's lives? And such a broad view of advocacy and systems change. So I'd really encourage you to talk to Jill. I think we have our Deputy Commissioner, Jennifer Jacobs, here, and other staff. So please seek out and find staff. Those water cooler conversations, which it's so amazing to see so many of you that I've worked with over the last 25, 30 years here in person. I'd really encourage you to get to know some of my other colleagues. So at ACL, we do a number of things. Of course, an incredibly important thing that we do is administer programs that are in every state and almost every community across the country. And many of you work with them, the protection and advocacy agencies, the DD councils, the USEDs, our centers for independent living, and our aging networks. We have a whole research arm, and I'm not going to steal any thunder from Anjali, but Anjali will talk about the important research that we do to advance community living. But an incredibly important role, and one that's very unique in the federal government, is that we serve as an advocacy role. In our statute, in our regulations, our job is to advocate for people with disabilities and older adults in all federal policies. We directly work with and serve as the advisor to our secretary and really work across the entire federal government. As the secretary says to me all the time, ACL is really the conscience of HHS, and it is our job to raise those policies. So how do we do that? We can't do that if we're not engaging with the community, if we're not hearing from you about what the real issues are, what's working and what's not working. So a really crucial piece of the work that we do is engaging stakeholders. And most importantly, the people who are most impacted, people with disabilities themselves, families, and of course, the whole range of other stakeholders, providers, et cetera. As Amy mentioned, ACL's mission is the mission of my own life. And for more than 40 years, I've been part of this community, working in two ways. One, to make sure that we are really expanding opportunities for inclusion in all aspects of life, in changing our service system. And I'll talk a little bit about some of the work that we're doing with partners like CMS. And in addition, as Amy mentioned, I've spent most of my career as a civil rights lawyer. And so when we talk about inclusion, when we talk about community living, it's not just what people want, it's not just what leads to better outcomes, it is a civil and human right. And everything that we do is about turning the promises of civil rights laws like the Americans with Disabilities Act and its promise of inclusion and community living into a reality. So let me turn now to talk about some of ACL's major priorities and initiatives. When I joined on the first day of the administration, we were in the middle of the worst of COVID. And I know I don't need to tell people in this room, rewind your mind back. It was at the time when literally our community was filled with people dying. We had people who were incredibly high risk being exposed to COVID. We know the data now. We know that people in our community, if they are infected by COVID, have incredibly higher rates of hospitalization and death. We were fighting at the state level as vaccines were just starting to be rolled out to prioritize our community reflective of the risk that people face, particularly people in congregate settings. Everyone had experienced a significant loss of services. Many family members had to leave work to take on responsibilities and fill in huge gaps. And of course, as I'm going to talk about in a moment and has been, looks like one of the biggest themes of this conference, the workforce that provides the important supports that help people remain and participate in the community really was beginning to be decimated. So from the moment that I got to ACL, I worked with my team and said, how can we work across the federal government and bring ACL and our networks as part of the solution? I'm also really good at going to other agencies and say, we can solve your problems if you give us some money to help us do it. So one of our first partnerships was with the Centers for Disease Control. They were really trying to get shots in arms, particularly to people who are highest risk and who face barriers. And I know I don't need to tell people here that if we just have the regular process of go online, sign up for something, go to a pharmacy, you need your own transportation, our community will be left behind. So we were able to get $100 million in funding from the CDC to push out to our networks on the ground. And I hope all of you have seen the fruits of that in your own community. The campaigns that our DD councils and Protection and Advocacy Agency and USEDS have done to make sure people understand and have clear information. The work that our CILs have done to provide transportation, to create pop-up clinics, to really target our community has been really incredible. We also were able to use funding to create the first time ever a national hotline to help people connect with local resources. We had that on the aging side, the elder care locator, for quite a while. And what we realized is there's not one place that people can call to find out, I'm looking for information about how to get a vaccine. How do I connect with, supports around housing, around nutrition? And it's been incredible. We have served nearly 50,000 people through this hotline in the less than a year that this has been up. And I'm really, really proud of that work and of all the partners that we worked with to launch it. So many of you recognize that in the response by our public health systems don't know how to meet the needs of people with disabilities. And when we're thinking about public health, so many people who maybe wouldn't have thought of themselves as part of the public health system really are. And so when the American Rescue Plan passed and there was a lot of funding to increase the public health workforce, I raised my hand, I elbowed my way in, and I said to the White House, to our secretary, our networks are doing what is public health work. Getting people out of high-risk institutions is public health work. Making sure that people have plain language and clear information about vaccines, about how to respond to disasters, is public health work. And we need to, our networks are positioned to work with public health agencies to expand the competencies. So we were able to push out $150 million to our networks to build those relationships. And hopefully this will bear fruit as we move forward. As we rolled out initiatives for masks and for tests to the general public, again, we said we need to make sure that we are reaching people who are hard to reach, who the regular pathways do not work for. And so we were able to build a partnership with the Health Services and Resources Administration at HHS to have our networks partner with federally qualified health centers to get masks, to get tests, and to distribute them to our communities. Again, I'm really interested after this session. I'd love to hear from people. Are you seeing this in your own communities? And finally, as I'm talking about COVID, we have to look forward. Our community is about to grow, and it has been growing in a huge way. We know enough to know now that long COVID is creating impacts. It is probably the largest mass disabling event in our lifetimes. And ACL has really taken the approach of, we need to be the welcome committee. Welcome to our community. You might not think of yourselves as a person with a disability, but we have resources, we have networks, and for people who have never navigated this system, it is complex. Not to get ahead of the White House and HHS, but later this week, we will be rolling out the first of a very big initiative in response to an executive order, looking at both what is the research agenda that needs to happen in terms of long COVID, but we know people need help now. And ACL played a critical role in a report that focuses on what are the services and supports that are out there to help people experiencing long COVID. And then finally, we know at some point, although not imminently, the public health emergency will end. And states have a lot of work to do to unwind these flexibilities and make sure people do not get left behind. And it is incredibly important that everyone in this room be at the table in their own states. Our partners at the Centers for Medicare and Medicaid Services are working, and there is a regular webinar that is for stakeholders, for states, about how to begin planning. And an important role that ACL plays is we need to translate it so it is understandable to our stakeholders and our communities. We have a lot of information that we have already pushed out, and we really want to be partners with you as we're looking at unwinding. The next thing I want to talk about is probably the most important thing that ACL does, and the efforts that we do to expand access to home and community-based services. COVID absolutely laid bare the fact that, again, this is not just what people want, this is life and death, that people are highest risk in institutional and congregate settings, and it is a health and safety issue to be expanding opportunities for people to live in the community. We have worked very closely with our partners at CMS, and truly because of y'all's incredible advocacy, the American Rescue Plan included the biggest increase in home and community-based services funding since the passage of the Affordable Care Act, with $12.7 billion. And believe me, we all know this is a drop in the bucket about what's needed. The administration and the president have made very clear this is just a down payment on what is needed, and your advocacy on what this money has meant and how much more need there is absolutely critical. But this money has made a big difference. And talking to many of you as we were getting coffee earlier this morning, I know many of you are working in your own states or providing technical assistance to states to make sure that money is being used in good ways, to support the incredible direct care workforce, to expand access for people who are sitting on wait lists, to help with institutional transitions. And so again, we are very interested in hearing from you and being able to lift up what this funding is able to do. I want to talk a little more about the direct care workforce. And again, looking across the conference, it is probably the thing that we all need to be thinking about and talking about. What has been a long-standing problem and a long-standing crisis has truly turned into an emergency. And as Amy said, if we don't have people to provide services, people will not be able to live in the community. It is truly an existential crisis that we are facing right now with the direct care workforce. A recent report that came out from many of the sponsors of this conference was shocking. At a time that more people need more services, 75% of providers are declining referrals, and 50% are cutting services. At a time when, again, looking at that report, this is the largest growing need in a workforce because we have more and more people aging, more and more people with disabilities in the community. So you can see, we are really, really facing a crisis. ACL was thrilled when Build Back Better and the draft that was passed by the House included substantial funding for us to partner with the Department of Labor to work on this. And I'll just say we were heartbroken when that did not happen. But we went to the drawing board and we said, we cannot do nothing. We're not giving any new money, but we need to find a way to take some initial steps. So I hope people have seen, and I'm really proud, it's just a start. I wish the zeros on it were about 10 times more, but we are launching later this summer the first ever national direct care workforce TA center. It's a start, and it's an important way that we have brought together the aging and the disability community with labor advocates, with the workforce, to try to identify what are things that are working in training, in credentialing, in opportunities for advancement. And at the end of the day, this is about paying good wages. This is about benefits, and we need to be part of the solution. There's a lot of disparate things happening across the federal government, and this TA Center and ACL has taken the lead in really pulling together our partners at CMS, at SAMHSA, at the Department of Labor to say, what tools do we have in our toolbox to start working on this and lifting up the good things that are happening in states. So I hope that once we launch this, so many of you will work with us. We have a lot of work to do together on this. When the president talks about caregiving and the caregiving infrastructure, and I know that's not always the word that we would use in this community, but it's resonating. It's on the front page of every paper. It's what Congress and states are talking about, so I'm just going to swallow it and embrace that terminology. When we talk about the caregiving infrastructure, there's of course the paid workforce, but we know that family caregivers are the ones who are truly the backbone of our long-term care system. We do not have enough supports in our system to give everyone what they need, and so much lands on families to pick up those pieces. It's been a real privilege at ACL for us to take a leadership role in thinking about and leveraging our programs and developing the first ever national strategy on supporting family caregivers. And of course, there's a tie between the direct care workforce and family caregivers. The less that, the issues that we have the direct care workforce put more on families. The relationships between families and the direct care workforce are incredibly important. And frankly, many families are becoming paid providers, particularly through the public health emergency. We are really excited that later this summer, last year we submitted an initial report to Congress and to the Secretary, and later this summer we will, hopefully by September, October, be rolling out this first ever national caregiver strategy that has commitments from the federal government, across the federal government, about steps we can take, but it also has important roles for all of you to push on what are best practices and ways to support family caregivers at the state level, at the local level. How do we bring together stakeholders? And really excited to work with many of you on that. I want to pivot to talk about the Hcbs settings rule, and I feel like, Amy, keep me honest here. I'm trying to think back to the last time I was at Reinventing Quality. I feel like I've been here wearing so many different hats. I feel like I might have even been here when we rolled out the Hcbs settings rule almost 8 years ago, talking to you about the incredible opportunity that we have before us to truly make sure that community services provide people real opportunities for integration and inclusion in all aspects of life. I don't think any of us could have predicted, or maybe we did, but we tried to be optimistic, how hard it would be to operationalize this, how challenging it would be at the real boots on the ground provider level, and then throw in 3 years of a pandemic in the middle. We really, really didn't predict that. We are working closely with CMS in really translating this rule into reality, and we do not have much time left. As all of you know, the rule goes into effect in March of 2023. At the same time, I hope most people have heard that there was a lot of pressure, there was a lot of push to just say, hey, let's extend the rule again. And speaking for ACL, we felt incredibly strongly that, people have been waiting their whole lives, but for 8 years, people have been waiting for the most basic civil rights. To be able to have visitors, to be able to lock your door, to be able to eat when you want to. And we could not kick that can down the road. On the other hand, we know that the public health emergency has made the direct care workforce crisis so challenging. We are seeing many settings, being combined. We are seeing such individualized services from the very best providers saying, we don't have the staff to do this. And what we did not want is to lower the threshold and say, the rule means less. So hopefully, as people know, CMS, and I was really pleased, and this is really from the top of HHS, has said, we are moving forward. This rule must be in place, but we do have some strategies to work with states on corrective action plans on pieces that relate to the public health emergency. If you can come in and say, we've tried to do our best, here are the barriers that we're experiencing, and here is our plan to get there, then CMS can work with states on specific settings to have more time. An important role that ACL plays, as I said, is making sure that the voices of people who are most impacted are heard. And as someone who, wearing maybe 3 or 4 hats back, developed the settings rule, the thing that we went to the mat on is public comment. That the voices of people who receive services have to be in the plan. It has to really be the driver. And we saw, like everything else, it was so much on people's plates during COVID, that the engagement by stakeholders really, really, really went down. So really thrilled and led by Jill Jacobs from the Administration on Disabilities. We were able to pull Nancy Thaler, formerly of Nasties, out of retirement to help us lead this initiative. We are working with our networks, and we really want to work with all of you to make sure that people are commenting, people are engaging as the rule is being implemented. And this isn't just about the rule for us. This is really about making sure people understand how to engage in Hcbs policy. Today, it's about the settings rule. Tomorrow, it may be about a waiver that's being renewed in your state or a cut that's being proposed. And we need to make sure we have those state-based coalitions. And then finally, in the bucket of community services, again, because of so many of your incredible advocacy, as part of the American Rescue Plan, and before that, Money Follows the Person was reauthorized. It was truly dying on the vine with these short-term reauthorizations that went on for 2 or 3 years. States were dropping out, and we were seeing transitions from institutions really plummeting at a time when, frankly, in COVID, we needed to see those going up and up and up. When the bill was passed, it expanded eligibility, it reopened it to states, And it's been really important as we've been working with CMS that our networks who have real expertise, our Centers for Independent Living, our PNAs, our aging networks, are at the table as we're working together on Money Follows the Person. I hope people saw that just in the last 2 months, for states that are participating in Money Follows the Person, we're trying to address some of the biggest barriers. And what we hear all the time is it's impossible to find accessible, affordable housing. I'm going to talk in a second about work that we are doing more broadly around expanding affordable, accessible housing, but I want to make sure people know with MFP, states can now use grant funding to provide short-term rental housing as you are bridging to affordable housing programs. It's huge. And I'm hopeful that states will really take advantage of this. So housing. It is absolutely impossible to talk about community living without talking about accessible, affordable, integrated housing. It is truly a huge barrier. And in our community and in the community of people with intellectual and developmental disabilities, it's not only a barrier to people leaving institutions, it's why so many people have no choice but to live with their families. It's why so many people have no choice but to live in a group home. And that is not person-centered. That is not true inclusion for people who would like to, like all of the rest of us, have their own home, have their own apartment, and choose with whom they live. That's why literally within the first week of my landing at ACL, I said, we have got to reach out to HUD. All of these new resources coming, we need to make sure that our community is part of it. And by last summer, we issued, and it is not easy to do joint work, we issued a joint HUD-HHS fact sheet to states to say, here are all the resources that are part of the American Rescue Plan around services, around housing. These are ways you can partner, and we want to start working at the state and local level to bring what is often very siloed communities of housing and services together, because we are all serving some of the same people. We were thrilled in December to announce the first ever partnership between HHS and HUD. And HHS, we have brought to the table not just ACL, but CMS, our partners at the Substance Abuse Mental Health Services Administration, and our research arm, together with HUD, and launched the first Housing and Services Resource Center. And I hope people will look online at the centralized hub of resources we've created. But what's more important is the work that we are doing with states and local communities, bringing together each of our networks, homelessness networks, the aging networks, the disability networks, public housing authorities, state Medicaid agencies, state IDD agencies, state behavioral health agencies, to really plan on how do we make sure people get both the supports and the housing that they need to truly live in the community. With respect to people with intellectual and developmental disabilities, I know I don't need to tell people here truly the dynamics that are happening in our community and what's filling the gaps as we are not having enough housing models out there, and really people recreating models that frankly are very institutional-like. So it is up to us to lift up models and to bring forward strategies of how do we develop inclusive housing. And I'm really proud that the Administration on Disabilities later this year will be launching a prize challenge to focus on inclusive housing solutions for people with IDD. We will certainly spread the word when that is out. Another aspect of community living that is so key, of course, is employment. All of us are defined not only by, where we live, but what we do during the day and how we contribute to society. And people with disabilities unequivocally want to and can work. We're continuing our partnerships across the federal government to advance policies to expand competitive integrated employment and end sub-minimum wages. It's been incredible to see the momentum just in the last 5 years, where states are going. I hope people saw a final regulation that just came out just this week from the Ability One program, ending sub-minimum wages in that federal program. And we know it's not just about the wages. It's about inclusion. It's about making sure people are matched to and find jobs that fit their skill sets and their talents, and that they get the support that they need to be successful there. ACL has a disability employment TA center that we've launched to work with our networks about how they can work at state and local levels to change policy and to change practice on the ground with a real focus on transition age youth. Again, we have really changed the paradigm of going from the school to sheltered workshop pipeline, but we cannot have people fall off a cliff and sitting on their sofa. And so the work that we are doing with transition age youth is really important. I want to mention, keep your eyes open. I'm hoping in the next 2 or 3 weeks, out of the WIOA Advisory Committee report, there were several recommendations for areas that there needed to be interagency guidance around blending and braiding and sequencing funding from all different agencies, how to do that, working towards the goal of employment, as well as about how we think about community engagement activities that wrap around but advance competitive integrated employment. So look for those resources, hopefully to be coming out in the coming weeks. I'm at a conference that has quality in the name, so definitely want to touch on briefly on quality community living, and that is a huge part of the work that we do at ACL. Quality involves obviously 2 pieces. We need to make sure that people are receiving services that really help them achieve the goals that they have in their own life. And at its core, we need to make sure that people are healthy and safe in the settings in the community. Our protection and advocacy agencies and long-term care ombudsmen play an incredibly critical role in this work, and we've been working very closely with the Centers for Medicare and Medicaid Services on work around quality. I hope everyone saw, again, I think it was just in the last 2 weeks, the first ever guidance from CMS on Hcbs quality measures. We need to have some standardization. We need to be able to compare apples to apples, and this is a really, really big, huge step. And at the same time, we have much more work to do around health and safety. It is really, really scary to think about not only where we were before the pandemic and all of the reports that came out from the Inspector General about people's basic needs not being met, particularly in congregate settings like group homes. But as we tie that in with the direct care workforce and we have turnover and we have less staff, people are at even higher risk for incidents, and we cannot not focus on that issue. We also know, and I was really pleased, Amy, to see that you had a strand around behavioral health. This is probably a huge undercount, but more than a third of people with IDD also have behavioral health needs. And that's a place where the administration is focusing so much on behavioral health, and we need to make sure our community is part of that work. Another place where ACL has really stepped up, we will be launching later this summer a first ever, again, TA center focused on people with co-occurring IDD and behavioral health needs, with the goal of bringing together IDD systems and behavioral health systems in states, and to really end the pointing, they're yours, no, they're yours, no, and we really need to take some of the investments and the strategies that are happening across the federal government and make sure that our community is included in that. Quality is also about making sure people with disabilities themselves have the tools to advocate for themselves. So self-advocacy is key. It's key to quality and it's key to safety. And we are continuing our investment in the Self-Advocacy and Technical Assistance Resource Center, SARTAC, as well as work that we're doing around alternatives to guardianship with our Center for Youth Voice and Youth Choice. And finally, as we're kind of talking about these issues of quality, as people with disabilities age, and when Evan was born, my brother, his expected lifespan was 12 years. 12 years. And now, well into his 60s or 70s, hopefully hundreds. But the lives of people with disabilities and intellectual disabilities has expanded so much. And we need to be thinking about, and ACL is so well positioned to think about, how do we think about older adults with IDD? And so we have an initiative around bridging the aging and disability networks that's really beginning that critically important work. Two other things I want to briefly touch on and then turn it to Anjali. As I said, civil rights is at the core of the work that we do at HHS and in ACL. And we have worked really closely with our partners at the Office for Civil Rights as well as the Department of Justice. I want to make sure that everyone is aware of a huge regulation that just came out last week. Section 1557 of the Affordable Care Act prohibits discrimination in any healthcare program that gets federal funding. And that is a lot. That is state Medicaid system, that's Medicare systems, that's when you go to the doctor. And it specifically prohibits discrimination on the basis of disability. This regulation is out for public comments, and I really, really hope all of you will engage. Just yesterday, we shared a blog highlighting some of the key pieces in there around effective communication, around the integration mandate being part for the first time of health plan design. Think about that. Think about how we now can use the integration mandate as we look at the choices state Medicaid systems are making in the services that they offer. So please engage, please join us. We're actually doing a webinar for the community on August 11th, but we need your voices engaged there. We are also, and ACL has stepped up as a full partner. For the first time, HHS is updating our Section 504 regulations, which are prohibit disability discrimination in any type of federal funding that comes from HHS. That's everything from discrimination in organ transplants and child welfare systems, the integration mandate, accessible medical equipment, and on and on. And so please keep your eyes open. This is the first time in 40 years we have had a chance to modernize our regulations, and we are going to need your voice and your input to make that successful. Finally, and I think it's a great bridge to turning it to Anjali, is the work that we've been doing at ACL around equity. Hopefully everyone is aware, really from the first day of the administration, the president has directed all of us to build equity into everything that we do. And in ACL and in the executive order, it really demands that we look through an intersectional lens. People with disabilities are explicitly called out. And we need to think about not just what are the impacts for people with disabilities and federal policies, but what are the impacts for disabled people who may be LGBTQ, or a person who is also a person of color, or from a rural area, or doesn't speak English as a first language. And we are really trying in two ways to advance equity. First, within our own networks, making sure that we are identifying and addressing the additional barriers that multiply marginalized people face, and making sure that we are engaging and hearing from people who have multiple identities. Second, we are playing an important role in everything that HHS is doing to address disparities. It's the constantly, don't forget about us. Don't forget about us. We are there to make sure that people with disabilities are included in that work. And just to give one example in the IDD space, we are working with our partners at the CDC to make sure that the National Health Interview Survey, which is where we survey the health of our country, includes information, and we can look at people with IDD. So in closing, let me just say, it's an incredible privilege to be at ACL, to have such an incredible staff that are so mission-driven, to have the wind behind us from the administration and from the secretary, and frankly, to work with all of you on these incredibly big and important issues, and things that I know we can work together to advance. So with that, I will turn it over to Anjali.
Thank you so much, Allison. I really appreciate it. As you heard, I am honored to have joined the Administration for Community Living, ACL, to serve as the director of NIDLR, the National Institute on Disability, Independent Living, and Rehabilitation Research. I've only been in the role for a little bit over a year, and it's taken me that long to get the name right of the agency and the institute that I lead. So there we go. I am a brown-skinned woman with black hair, wearing a red and black top with a black suit, and I'm sitting in a manual wheelchair. I'm so thrilled to get to share some of my story and how it really resonates with many of the points that Allyson Barkov was making, and how it is that I really sit in this particular role at the intersection of both research and activism, and how I've been able to really bring those two together, particularly in this role, and helping to shape and to lead the priorities across ACL. For those who don't know, NIDLR is the federal government's primary disability research organization. And so our main purpose is to fund grants that will generate new knowledge and to promote effective use, to promote the abilities of individuals with disabilities to perform activities of their choice and to fully participate in society. I love that NIDLR was created back in 1978 due to amendments in the Rehabilitation Act of 1973. I love this because 50 years ago, there was enough forward thinking that put this into statute to say that disability research matters. And to me, that signals such an important message for our community and for all of us here in this particular room. I also believe that it's important for us to continue to engage, as Alison was saying and as Amy was saying, it's important for us to engage as researchers with every single one of you and your roles, because that's what informs the research agendas that we are putting out. It should be informing the research that we are doing, as well as where we go next. And so I have several questions that I'm just going to plant in throughout my talk here today, because I also have a whole other session at 10:30 with all of you, and I hope to hear answers to some of these questions from you all in that conversation. So one question that I have is, how do you, as direct support professionals and in your role, how do you use research? How do you consume it, particularly within the disability and rehabilitation space? You know, when I think about my role at NIDLR, we are that research arm, but I work so closely with Commissioner Jill Jacobs and Deputy Director Jennifer Johnson over in AOD and with Alison to make sure that the programs and services and what's happening at the state level and all the way across the nation is being informed by the research that's being generated from NIDLR, and vice versa. That the things happening on the ground with our PNAs and our SILs and in our states are also informing that creation of our research agenda. And I would not be able to do my job without that symbiotic relationship. Also, as part of my role, I chair the Interagency Committee on Disability Research. And during the COVID pandemic, this particular role has never been, in my mind, more important than ever, because one of the missions of the ICDR, the Interagency Committee on Disability Research, is to promote coordination across our federal government on anything related to disability research and disability data. Well, this is a long-standing problem in terms of how it is we ask those disability-related questions. It relates to the main topic of this particular conference in terms of measurement, which I'll talk about in a little bit. But the COVID pandemic really amplified the importance of needing that cross-coordination so that all of the work going in to deliver vaccines on the ground, to get PPE out to the disability community, that we were actually all on the same page in terms of not only what the needs were, but also how we were tracking the data and what that means for people with disabilities. Before I jump into some of the key NIDLR grantee work that supports many of the points that have been shared, I do want to share a little bit of background about my why and how that has brought me to this work. every single one of the pieces of my identity has guided my personal and professional trajectory. And I always say that it's every single one of those identities that shapes the lens that I bring to the research and leading a research enterprise. And so it is that intersection of being a Paralympic medalist, as you heard, an Indian adoptee, a disabled woman of color, a researcher, and an activist, and human to service dog Colton, who is under the table, who gets very upset if I don't introduce and acknowledge him in my talk. So Colton, we love him. When in many of when I look at my career trajectory, it has been circuitous, but I do believe that the transparency about identities is fundamentally important for every single one of us. And so another question that I pose to you all is, what initially got you interested into being in this field? How did you find your way into the field of disability work? You know, for many of us, it might be something personal. It might be a family member. It might be our own identities. It might be that you were just in the right place at the right time. It might be that, you just needed a paycheck. Like it could be any single one of those things. But here you all still are. And many of you I know have been in this field for many decades. And so part of the other role that I play at NIDLR is capacity building. And how do we make sure that we have good, strong leaders and representatives for our community for those generations to come? And so again, we have to be reflective of our own story so that we can hopefully, welcome others into the fold and grow this space. So as I shared, I do use a wheelchair and was adopted from India. And I have two white parents and two brothers and a sister. And when I arrived in the United States, I got sick with transverse myelitis, which is a focal inflammation of the spinal cord. And so being so young when I acquired my disability, I actually thought everyone in the whole world had a disability and that this was just a phase that I was one day going to outgrow. And when I take a minute to kind of peel that onion back a little bit and to really critically analyze why did little Anjali think that was the case? It was because every adult that I knew could walk. And so I put this assumption on myself that in order to go to college, in order to get a job, in order to have a family or to participate in society, I thought that I had to get rid of my disability. And boy, could I not have been more wrong on that one. So how did I learn that? It was through engagement with the direct support professionals, with individuals within the disability community. It actually all started with watching the Boston Marathon and seeing people in racing wheelchairs go flying by. And it was the first time that I saw adults with disabilities who ended up on the front page of the newspaper and on my television. And I started realizing, there is a pathway. I can grow up and still have a disability. And that was, to me, it then opened this tremendous door to being able to participate in it was an hour and a half long, once a week, Saturday sports clinic that was an hour and a half away from my parents' house. And it was led by volunteer rehabilitation counselors, physical therapists, rec therapists, and so forth in the community, occupational therapists. I don't even remember all the other types of roles, and parents of individuals with disabilities, and PCAs. Like it was run by the community as a chance to just get kids together and let them play and let them meet one another and have fun. And that for me was so powerful because it gave me a community to learn how to navigate many of the flawed systems and inaccessible systems that we encounter. It gave me a community to process when I encountered ableism, which I certainly have in my life. But then it also empowered me to then be able to go on to be a support to others navigating these systems themselves, and to really be able to be a part of the solution to then improve these systems and to help to leave the world a little bit of a better place. Now in my role at NIDLR, I get to be on the other side of being a federal funder, helping to not only shape that disability research agenda, but to also signal boost the incredible work that's being carried out by many of you here in this room and by NIDLR grantees who are committed to reinventing quality. Another layer of my why. So that was some of my personal story in terms of the why. But beyond my own personal identities and supporting friends, colleagues in the disability community to navigate, it's also my brother. So my brother is an adult with various disability diagnoses, including serious mental illness. And he's much younger than I am. And throughout our adult lives, we have not lived even within driving distance of one another. And so as he's been struggling to navigate many of these complicated systems to gain access to home and community-based services, a few years ago, we had a family meeting that my brother asked for us to all participate in. And we were not told much about this meeting in advance, but my brother was working on some long-term planning and he wanted us to be there. So we showed up. We all enthusiastically agreed, and it really had, at this point, taken quite a long time for him to initiate asks, and so we really were excited for the opportunity to be asked to participate in this conversation with him and to be a supporter for him. And at the beginning, and this story is shared with permission, I should have also said, and at the beginning of the conversation, he wanted to teach us about this thing that he had been learning about called person-centered planning. And he asked if we had ever heard of it before. And I said, yes, but I'd love to hear about it from you. And I was just smiling ear to ear, and I was just thrilled that he was demonstrating the self-determination and the agency to call us all together, number one, to educate his family members that he was leading and guiding the entire conversation. And to be honest, it was the first time that the space had been created that allowed for him to share his worries and fears about the future and his needs and to hear what supports he felt would be most helpful for him. And this tangible example is really fundamental to my why. And again, we all have really important whys for ourselves in our own personal and professional journeys. And as a researcher, all of those whys are the lens that shapes the research works, the work that I have been engaged in. It also approaches how we collect the data too, data collection. It shapes how we analyze the data and how we interpret and share the findings. Who do we share those findings with? And so that why is really not only what grounds me, but it also is what motivates me to push for transformational systemic change to improve quality measurement, to promote quality community living and participation in society for all with disabilities. And so, when I think about what it means to reinvent quality, to do this is to be brave enough to challenge the status quo. And it's about transforming systems that have been in place for a very, very long time. And spoiler alert, it's not easy. I mean, we have to be able to learn from one another and to be able to check our own biases as we're engaging in this work, but also to really, precisely bring us all together. And this really, to me, is the heart and soul of this conference. It's bringing together researchers, state leaders, direct support workers, disabled individuals, family members, all of us with that opportunity to learn from one another and to be able to really push the field in new ways. I'm also a big quote person, so this is a quote from Margaret Mead, who said, "Never doubt that a small group of thoughtful and committed citizens can change the world. Indeed, it's the only thing that ever has." Well, when I think about that quote and I think about what it means for the field of home and community-based services, for the field of reinventing quality, it's this group of people that is going to change these systems. It really is. And as my colleague, the Commissioner for ACL's Administration on Disability, Jill Jacobs, has said, and Alison has said too, and Amy, we are in a crisis. And, Jill Jacobs, I'm paraphrasing something that she has said before, which is, it's like a fire, and we need to do all that we can to save our children, our siblings, our loved ones, our friends with disabilities. Things are burning all around, and systematic flaws are more apparent now more than ever. And I will add to that too, that it's exacerbated for individuals who are multiply marginalized like myself. But the caregiving crisis is so very, very real. And this is the time where that quote really resonates with me in terms of the importance of really coming together and to commit to stronger measures, to think creatively about how to come up with solutions to save us all from the fire. When I reflect on some of my own personal experience related to the caregiving crisis and direct care workforce, it's been my experience in particular when recovering from major surgeries that I've had to rely on the direct care workforce, which is a very different experience than somebody like my brother. It's very different from some individuals who rely on 24-hour PCA services and things like that. But it's a spectrum of need, and so it's important to think of it from, you know, somebody like myself who might rely on services on a temporary basis, all the way up to individuals that might need this on a full-time basis as well, and that anyone with a disability can have setbacks and can have hospitalizations or surgeries, and so those caregiving needs may change, and they will change, and that's another layer that just exacerbates this crisis even more. So when I reflect on some of the experiences and research that some NIDLR grantees are doing in this space, I have so many examples, way too many, that I will be able to share with you all today. So I've just picked just a few that really helps to resonate and to highlight some of the what I think are important to help us to think creatively and to think systematically. So through the National Disability Institute in partnership with Virginia's state VR agency, we fund some work related to the Able Now program, and they are in the process of conducting an intervention study on financial engagement as a gateway to community participation. And they're really exploring the impact of Able accounts in their ability to then increase community participation for individuals with intellectual and developmental disabilities. And this is one tangible example of hopefully really having this critical analysis of the benefits and the impact of Able accounts to be able to have other states be able to learn and to replicate this work. Another example is that although many individuals with intellectual and developmental disabilities are increasingly likely to become parents, oftentimes many formal services and systems don't acknowledge that reality. And so there's often a focus on adults with developmental disabilities, as we know, within this space on person-centered planning, but this has not transitioned in all of the ways that we would like it to in relation to parent-centered planning. And so we have a grantee that's really working to bring those two concepts together in terms of parent-centered planning for parents with disabilities to be able to talk to family members and other supporters about the services and equipment and supports that they might need to raise their children successfully. And so this is intended to help to inform professionals who work with parents with IDD, who can use this model to really be able to continue to help to advocate for parent-centered planning model. And another really exciting piece about this particular work is being able to lead by example and to lead by the lived experiences, many of those key pieces that are at the heart of both ACL and NIDLR. In relation to home and community-based services, again, so many examples across NIDLR's portfolio, but we fund 2 rehabilitation research and training centers that specifically relate to measuring quality home and community-based services for people with a wide range of disabilities. And the priority work of these grantees is to focus on measures that matter to people with disabilities who receive these services. And University of Minnesota is one of these groups, and they are in the process of field testing measures that they've developed, and to really make sure that the measures themselves are person-centered in their approaches. And they also have a wonderful inventory of home and community-based outcome measures as well. Relevant in particular to Baltimore, as we're sitting here in Baltimore today, we also have a grantee who is focused on family quality of life and other benefits of home and community-based services waivers for children and youth with autism, and really looking qualitatively to capture stories from parent perspectives, from users of the Hcbs waiver services, and we're looking to figure out what are the outcomes that are explained by providers of services who were trained and allowed parents opportunities for choice regarding the provision of services to meet children and family needs. And so the results of this study, it was interesting because they actually found that there's the results of the study found that the family quality of life was lower for both groups, whether or not they were a part of the waiver program or not. And so I raise this because it shows the nuance of needed input from direct support providers, such as all of you, to help to shape the next research that is needed. So why do we think this is? So both study groups, just to say it more succinctly, because I got a little confused there, both study groups reported lower satisfaction with family quality of life, whether or not they were a part of the waiver program or not. And so it just led to the researchers saying, why? Like, what is it that was going on that led to, there not being this difference? And we need more work to better understand what are the effective features of the waiver. So it felt like just sort of that broader categorization, and this is the researcher in me, that broad categorization of waiver or not waiver, the microscope was too zoomed out, if you will, and that we need help from all of you to shape that next piece of that research agenda of where should we narrow, like how should we zoom in, and is it a specific feature of that waiver program that makes it that is making a specific difference? Is it a specific combination of features? Is it related to dosage of the amount of time with certain providers over others? Like, what is it that we needed to hone in on? Because we also know that there are tremendous benefits to these programs in terms of access to services. So it's one of those, we have to interpret the findings with caution, but then rely on assistance from us all in terms of where we go next. Another example is from Ohio State University, and they are working to adapt the diagnostic interview for adolescents and adults with intellectual disabilities and the functional neutral health-related quality of life measure. These particular measurement tools are designed to allow people with IDD to self-report their subjective health and well-being, and it's really moving away from reliance on proxy respondents. So it's really saying, hey, how can we, and many of our grantees are doing this important work, how can, instead of relying on a proxy to capture information from an individual living with IDD, how can we redesign the measure to make the measure itself accessible, cognitively accessible for individuals with IDD? And there might be accommodations that need to be provided for how a person is responding to those survey questions and so forth. But let's reinvent the field of measurement from these basic principles of universal design, and let's just reinvent and make the measurement tools better, as opposed to then relying on somebody else to respond on behalf of someone else. So this is, to me, is another really strong example of the exciting work that is occurring. As Alison mentioned, we at ACL and across NIDLR, we are being extremely responsive to Biden's executive orders on equity. And there are two executive orders, in fact, one that's internal to the federal government, so the internal workforce, and it affects the programs and the grants and the services that we provide internal to the government. And then one is external to the government in terms of the work that we do with all of you. But both of them name disability and accessibility as being key fundamental aspects. And for me, as a funder and a policymaker, it's so exciting that it's named there, and it helps to signal this importance of disability and its role in these equity conversations in a really big way. It helps us to be able to point to that, saying, hey, for decades, many of us have said, hey, don't forget about disability. And we can say, look, it's a part of these executive orders. And so now we're able to point to that and then build off of that. Within ACL, we are so excited that we are establishing a consortium of ACL equity centers. So it's 3 rehabilitation research and training centers on disability and equity related to research on employment, community living, and health and function, and a Center for Equity, Disability, and Intersectionality, which is designed to be a national resource center to promote inclusive, culturally competent services, best practices, and to help to develop the next generation of leaders that are engaged in this space. I'm really excited that with all of these ACL equity centers, we built in that they have to coordinate with one another. So that, again, this is drawing from the work that I'm doing with the ICDR of coordination is key. But if you don't put it in that funding opportunity announcement, you can't assume that it would happen on its own. So working with Commissioner Jill Jacobs, we made sure that we put that in there to really hopefully bolster that coordination, but also so that then we can all learn from the projects and the work that are going to be generated from these particular centers. So lastly, as I want to expand a little bit more on quality measures and what that means as connected to equity. So measurement tools, particularly within the disability community, have far too often been used as a gatekeeping mechanism that often it determines whether individuals with disabilities can receive access to services, what services they can get access to. In some cases, it has led to segregation of people with disabilities as just in terms of how these measures have been used. And so to do and to carry out this work, yes, we need quality measures, but we also need to be critical consumers of the measures that we are using. So for people with disabilities themselves need to be a part in that measurement development process. Direct support providers need to also be a part of informing the measurement tool development and refining, like I was sharing with that example. Stakeholders and all of us need to be able to critically look at measures and to be able to say, hey, what is most important for people with disabilities and their families, and how can we use these tools to better improve and to measure quality and the efficacy of the supports that they receive. But a really, really, really important piece in terms of being a critical consumer of measures is that a measure is only valid for the population that it was created with. And this is something that many individuals don't realize or haven't really thought about. And so this is Professor Anjali here explaining what this means. So the psychometric properties of the item, so of the questions asked on the survey tool or on the measurement tool, can and do change based on who is taking the assessment. And so it depends, were those questions developed, who was sampled when those questions were initially developed. So if it was a group of individuals that is not multiply diverse, multiply marginalized, did not include a vast representation of people with disabilities, then that's not going to help when you implement that measure nationally.